To our ever dynamic and gorgeous professor, Ma'am Nerissa M. Beatriz, to my dear classmates, good day. I am Luis Moralio, the first reporter for this topic, and to be followed by Ma'am Richelle P. Ochano and Ma'am Arlene B. Gobang. So our topic is all about growth and development during adolescence. So it's me again, Ma'am Luis, the first reporter. First is, what is adolescence? So adolescence is a transitional stage of physical and psychological development that generally occurs during the period from puberty to adulthood. Adolescence is usually associated with the teenage years, but its physical, psychological, or cultural expressions may begin earlier and later. So this is what we mean by adolescence. So all of us, so lahat po tayo dumaan sa pagiging adolescent. So this is the stage kung saan nagbabago na yung mga physical features ng ating katawan, yung the way we talk, and so yung mga voice ng mga lalaki, ayan. So this is where it begins. So sometimes mayroon pong mga nauuna and mayroon sometimes naman rin po mayroong nahuhuli yung adolescent stage po nila. So it's up to the body kung sino man yung maganitong experience. So this is what we mean by adolescence. We have the stages of adolescence. So the first one is the early adolescence, occurs between the age of 10 and 13 years. Middle adolescence occurs between the age of 14 and 17 years. Late adolescence occurs between the age of 18 and 19. And this stage is also called young adulthood. So these are the three stages of adolescence. So we have the growth. So as I've said a while ago, in adolescence, so nagbabago na yung physical features natin. So meron ng growth na sinasabi. So during early adolescence, growth is rapid due to the hormonal changes of puberty, but it decreases in middle and late adolescence. Girls and boys experience changes not only in size but also in appearance. So this is what do we mean by growth. So, because of the hormonal changes na nangyayari sa ating katawan, parang bumibilis yung paglaki natin and pag-iba ng physical appearance natin. It's because of the hormonal changes. So, naranasan din po natin ito. So we have the weight in growth. So the weight in the adolescent or in the puberty stage, the average weight increases in adolescent boys is 7 to 30 kilograms or 15 to 65 pounds. And for the female, adolescents will demonstrate a weight increase of 7 to 25 kilograms or 15 to 55 pounds over the course of this period. So, dito naman po as in the weight, so most of us nagiging tayo ng weight so pagtungtong natin ng adolescent stage. So, hindi natin maiiwasan na mag-gain tayo ng weight kasi nga pumapasok na tayo doon sa adolescent stage. So we have also in the physical appearance or in the growth is the second one is the height. Ayan. So the growth trend may be characterized by a period of rapid growth or the growth spurt. then slow growth, then another period of rapid growth. Girls experience a rapid increase in height before menarche, and full height is usually reached to 2 and 2.5 years after menarche. So yung pagbigin po ng menstruation, that is what we mean by menarche. The average increase in height for girls is 5 to 20 centimeters or 2 to 8 inches. And boys start their growth spurt between the age of 10 and a half and 16 years, and it ends between the age of 13 and a half and 17 and a half years. So the average increase in height for boys is 10 to 30 centimeters and 4 to 12 inches. So in height naman po, so pag pumapasok na yung mga bata in the adolescent stage, ayan, so nag-i-increase na yung height nila or tumatangkad na po sila. So these are the inches. Yan. For the girls, 2 to 8, and for the boys is 4 to 12 inches. So yan po yung naidadagdag doon sa height nung mga bata as they go on to the puberty stage or in the adolescent stage. So, mapapansin nyo po yan sa kung mayroon na kayong mga anak, ayan, so kung mayroon kayong kapatid na ganyang nasa edad, so mapapansin nyo po yung pagtangkad nila at pag-gain nila ng weight. We have also the body mass index. So, throughout adolescence, body mass index or BMI is calculated based on the person's weight and height. So, dito naman po sa BMI, so dapat magtali yung weight mo dun sa height mo. Opo. So, it means you're normal. So, pag hindi naman po masyadong nagtali, it means it's either you're underweight or overweight. So the BMI is then evaluated on the gender-appropriate growth chart to determine if it falls within the normal range of the 5th to the 85th percentile for age. And so if BMI is less than the 5th percentile, the adolescent is considered underweight. Between the 85th and 95th, it's considered overweight. So, and obesity is defined by a BMI greater than 95th percentile for age. Yan. Opo. So, as I've said a while ago, so depende po yun sa age nung bata. So, for example, yung age ng bata is 13 years old and yung weight niya is lagpas doon sa edad niya and pati doon sa height niya. And so, maybe she is underweight. Ayan. So, kulang siya sa weight. Opo. So, this is how do we determine the body mass index. So, meron naman po tayong mga nare-research sa internet. Opo, para malaman natin kung yung anak ba natin o yung mga kapinsanan, yung kapatid, is tama po yung BMI po nila. Okay po? So, also in growth, kasama na rin po dito yung physical changes. So, hindi po ito mawawala itong physical changes kasi malaki nga po yung pinagbabago as they turned or as they go on to the adolescent stage. So, during adolescence, all organ systems reach full adult maturation. So, the head, neck, and hands reach adult proportions, and the percentage of body fat is increased. The brain size does not increase further, but faster neural processing occurs in response to myelination of the neurons. The heart rate decreases, systolic blood pressure increases, and the respiratory rate decreases, all reaching adult norms by the end of the adolescent period. And during the adolescent's growth, spurt, strength, and muscle mass increase in both boys and girls. So additionally, the adolescent skin becomes tougher and thicker. The sweat glands functions at adult level. So dito na po tayo sa physical changes. So nag-iiba na nga yung itsura ng ating katawan. Yung head natin, yung neck, yung hands. So nagiging proportion na sila. So sometimes in the girls, 'di ba, nagbabago yung breast natin. So, for the boys, so nagkakaroon sila ng mga muscles. Ayan, so meron na silang, sometimes meron silang mga beard. Yan. So, yan po kasama yung physical changes. So, nakikita natin yan. Opo, sa panlabas po yan na anyo. So, kaya mapapansin po natin agad kung ano yung nagbago doon sa bata. Yeah. So, puberty. What is puberty? Puberty generally refers to the biological process of developing adult-like hormonal regulatory system. So, there are 5 stages that define puberty. Although, all adolescents move through each stage in order. The progression rate varies per individual adolescent. So, the sexual maturity ratings or SMR, so later i-discuss ko rin yan, also known as the Tanner stages, are used to assess adolescents' development from pre-pubertal to adult. The SMR are based on sexual characteristics. It is helpful to have a picture diagram during the health supervision visit so that the adolescent can visualize what changes to expect. Ayan. So, in the puberty, so dito na nga natin malalaman kung ano yung mga pinagbabago ng katawan natin. So, para hindi naman ma-shock yung kids or yung mga anak natin o yung mga anak nyo po, yung mga kapatid nyo. So, much better if you inform them na these are the changes that might happen in your body. So, these are the SMR or the sexual maturity ratings for the girls and for the boys. So, this one is for the female sexual maturity rating. So, we have here a picture of breast development. So, mamaya yan. So, let's come now first in ovaries. So, during puberty, the ovaries enlarge in size and produce estrogen and progesterone. So, estrogen is the hormone responsible for breast growth as well as development of the vagina, uterus, and fallopian tube. So, yung ovaries, yung dito yan sa loob po ng girls. Ayan. So, lumalaki na rin yan. So, as nagdadagdag sila ng age or ano na sila sa puberty stage or adolescent stage. So, nag-i-enlarge yan and nagpo-produce na rin sila ng estrogen and progesterone. Ayan. So, the next one in SMR is the breast development. So, we have here a picture. So, in the breast development, breast budding begins to occur around age 8 for most females. Ayan. So, sometimes 8 years old pa lang, ayan, so lumalaki na yung dede o yung breast ng babae. So, breast development is complete between ages 12 and 18. So, soreness and tenderness of the breast, specifically around the nipple, are common complaints during puberty by boys and girls. Ayan, so pati yung boys, sometimes nagko-complain rin sila, if sometimes, diba, sobrang sakit ng ating nipples. Ayan, so, because nga po, nagde-develop yung breast natin. So, di ba, naranasan rin naman po natin yun. So, we have here the stage in breast development. So, the stage 1 is the pubertal or nipple elevation begins. Ayan, so nag-elevate na po yung nipple. So, stage 2, breast budding. Ayan, so nag-elevate na rin yung breast natin. Pero medyo nag-elevate na. Stage 3, nagko-continue siyang mag-enlarge. Stage 4, secondary mound. The secondary mound forms beyond the original breast. Ayan, so yung breast natin, and then mas nagla-large pa. Mayroon pa tayong tinatawag na secondary mound. And stage 5, breast maturity. So, ito na yung natin ng breast natin. Ayan. So, the nipple projects and the areola becomes part of the breast contour. So, this is the stage or the breast development. Okay? So, ito po yung mostly yan, na nangyayari sa ating girls. Tapos tayo sa ating mga babae during the adolescence period. Next is the linear growth. Ayan. So, females usually see their body get curvier during puberty. So, there is an increase in fat production, especially around the breast and hip, which is normally processed. Ayan. So, dito naman sa linear growth, so parang nagkaka-shape na. Ayan. So, nagkaka-shape na yung ating katawan. Yung parang meron na tayong Coca-Cola body na ika nga. And yung hips natin is nag-large na. Ayan, opo. So, it's because of the linear growth, opo, na nangyayari nga during the adolescence. And it's normal, opo. Ayan. Next naman is the pubic hair. Ayan. So, meron din tayo ditong picture ng pubic hair. So, pubic hair begin to develop prior to adolescence but reaches adult patterns by age 18 years. So, the pubic hair typically develops in a triangular pattern. Ayan. So, parang katulad nga po ng nakikita natin dito sa picture. So, this we have the stage 1. Ayan. So, stage 1, wala pang hair. Stage 2, ayan. So, meron ng kaunting sparse, long, straight hair. Stage 3, nagda-dark na siya, nagda-darker. Yan, nagka-curl na siya. Ayan. And stage 4, more darker. Yan. Opo, nagka-curl, abundant hair over the mons pubis. And stage 5, yan, adult triangle pattern with hair growth with medial thighs. Ayan. So, ito na po yung nangyayari during the adolescence. So, it's better na i-inform natin yung mga bata na mayroong mangyayari sa kanilang tutubuan sila ng buhok in our private area para hindi naman sila ma-shock. Ayan. So, this is the pubic hair. Next is the menarche. Ayan. So, the first menstrual period typically begins during the time of linear growth deceleration. So, 11 to 12 years of age. Breast budding is often noted about 2 years prior to menarche. So, the average age of menarche in the United States is 12 years. Ayan. So, in the United States pala, mostly yung mga girls, so 12 years old sila, nagkaka-menstruation. Pero in the Philippines, sometimes, 11 or 10 years old yan. So, as early as 10 years old, minsan nagkaka-menstrual period na. So, hindi natin alam kung what's the reason behind that. But mostly 11 to 12 years old. Mayroon lang mga instances na mayroong 10 years old, minsan nga 9 years old, and mayroon namang instances na very late na talaga silang mag-menstrual period. Ayan. So, this is the menarche. So, ito na yung time na in the first period. So, kailangan natin i-guide yung mga girls na kasama natin or first time pa lang nila. So, kailangan natin nilang guidance. So, what do they need to do kung mayroon silang menstrual period? Because that's their first time. So, kailangan natin silang i-inform na ganito dapat yung mga things na gagawin nila during their menstrual period. So, these are the female sexual maturity ratings. So, let's come now po to the male sexual maturity ratings. Ayan, so we have here the testicular enlargement. So, yung mga, yan po yan. So, this one, yan. So, yung tinatawag nga nating mga eggs, yan. So, the enlargement of testicles and the scrotal sac is the first sign of puberty in males. The color of the scrotum gets darker, the skin begins to thin, and tiny bumps or mayroon ng hair follicles appear as the testicles enlarge. So, most males will have one testicle, commonly the left hanging lower than the other does. So the penis, shaft, and glans also increase in size. Ayan, so yung mga sa boys naman po during the adolescence period, so nag-i-enlarge yung mga testicular nila. Yan. Opo, so yung mga eggs na tinatawag. Yan. Opo. So that's all about the testicular enlargement. Next is the pubic hair. So, in the pubic hair, mayroon rin tayong tinatawag na in the pubic hair, just like in the girls, so mayroon ding pubic hair ang mga boys. So the second sign of puberty in males is the development of pubic hair, which appears shortly after the increased testicular size. So hair development first appears near the base of penis in a diamond shape. So, di ba kanina yung sa girls, it's triangular shape. So, in the boys naman, we have diamond shape. So, as the hair grows, it becomes coarse in texture, curly, and turns darker. So, over the next few years, the hair covers the entire pubic area and begins to extend to the entire area on both sides. And the appearance of hair on the face, legs, arms, and chest starts to occur about 2 years after pubic hair development. So, these are the stages. So, mayroon ng Stage 1 in pre-adolescent or no pubic hair. Penis and testes are same size and proportion as in childhood. In the stage 2, mayroon ng konting hair. Yan, so naging enlarge na rin yung penis and yung testes. In the stage 3, nagda-dark na, mayroon darker na yung hair, nag-enlarge na rin yung penis and yung testes. And in stage 4, ayan, so marami na po yung curly pubic hair. So mayroon ng maraming area na nako-cover and enlargement pa rin ng penis and testes. And in the stage 5, ayan, so spread na yung hair in the thighs. Ayan. And the penis is already nag-large na rin siya. And of course, the testes. Ayan. So this is the stages. Next is the length and width of the penis. Ayan. So, ito na nga yung sinabi ko na nga kanina. In the picture, nakikita nyo naman po na as they go on in their adolescent stage, ayan. So, nag-i-enlarge rin yung kanilang penis. Opo. So, for the boys lang yan. For the male. So, the penis grows in length. Then in width, it is not uncommon for a 13-year-old to have genitals the size of an adult. So the average range for penile maturation is 13 to 18 years of age. So at this point, in sexual development, it is common for boys to frequently assess their penis and compare their size with others in their developmental age group. Ayan. So sometimes, nangyayari nga yan na kino-compare ata nung mga boys yung kanilang penis with the other boys. Ayan. So nagsisimula na large or humahaba yung penis during the 13 to 18 years of age. So, next is the fertility or spermatogen. Yan. So, about 1 year after the testicles begin to enlarge, boys are able to reproduce. So, the testicles are now able to produce sperm as well as testosterone. So, the Cupid's glands and the prostates combine with the sperm to produce semen during ejaculation. Each ejaculation has approximately 200 million to 500 million sperm. Wow! It is common for the first ejaculation to occur during masturbation. So, nocturnal emissions, also known as wet dreams, are not uncommon with the developmental of sexual maturation. Ayan. Opo. So, here naman in the fertility and fertility. So, in the male, so, pwede na silang makaproduce ng sperms. Ayan. So, ika nga pwede nang makabuntis, pero wag na muna. Ayan. Opo, kung mga bata pa. So, nagde-develop na dito yung fertility. And, mayroon tayo dito tinatawag na ejaculation. And, mayroong sperm na siguro nilalabas during the ejaculation is 200 million to 500 million sperm. So, imagine that. So, marami Okay po, so that's the fertility for the male post-sexual maturity ratings. And the last one is the vocal changes. So the larynx and vocal cords enlarge shortly after growth spurt. Ayan. So the first noticeable sign is the voice cracking, which later turns into a deeper voice. The Adam's apple gets larger. Ayan. So yung mga girls, do mula sila nito yung Adam's apple but only for the male. Yan. So meron silang Adam's apple and yung voice nila parang nagdi-deeper, parang no naglalagong. Ayan. Opo. So parang nagdi-deeper yung voice nung mga male. Ayan. So sa kanila lang yan nangyayari kasi sa girls parang hindi naman yun nangyayari. Yan. So, those are the male sexual maturity rating. So, then, so thank you so much for listening. So, that's all about my report. So, I hope you learned something about my report. So, the next report to be reported by Ma'am Rachel P. Ochan. Goodbye, everyone! Thank you so much.
Good day, everyone. I'm Mrs. Rochelle Occiano, and the assigned topic that I'm going to report today is about adolescents' development milestones. So, this is a time of changes for how teenagers think, feel, and interact with others, and how their bodies grow. Here are some information on how teens develop. So, the first one is the gross motor skills. By adolescence, coordination, general motor ability, physical endurance, and strength increase. Adolescents can participate in the following activities to facilitate strengthening of motor skills, like bowling, walking or climbing, swimming, riding a bike, dancing, and playing on movable bridges and rope ladders. Adolescent males typically make significant gains in their gross motor skills before the age of 14 years, whereas most adolescent females only make minimal gains until the age of 14 years. So the gross motor skill development continues until the early 20s. Now let's move on with the next developmental milestone, which is the fine motor skills. Fine motor skills develop at the same pace as gross motor skills. During adolescence, increased coordination of small movements of the hand occurs. Adolescents are more equipped to move with precision. Specific activities may assist the adolescent with building fine motors. So those activities include cooking, say for instance, chopping vegetables or kneading pizza dough, playing a musical instrument like woodwind and guitar, juggling blocks, handiwork, crafts, artistic endeavors, and solving 3D puzzles. The next developmental milestone is the language skills. Most adolescents are able to read on an adult level unless there are developmental delays. During adolescence, language begins to include a higher use of words, in part because of more abstract thinking. Adolescents are more inclined to analyze the function of words and their meaning. The ability to compare and contrast two concepts and understand the use of metaphor increases during adolescence. So they begin to mature in their use of irony, wit, and humor. So the next developmental milestone of an adolescence is the cognitive development. So this is very important. cognitive development during adolescence is often referenced as the time one moves from childlike thinking to adult thinking. Adolescents begin to think and reason in a more complex manner. They are able to think about different possibilities and consider the thoughts of others, indicating a maturation of skills in empathy and caring. So overall, cognitive development generally occurs between the age 12 to 18. However, the rate varies with each adolescent. During this period of growth, adolescents from their own worldview, and it directly affects and is affected by their cognitive development. Early adolescence is characterized by an increase in challenging of social or societal roles and standards. Adolescents may be highly idealistic and see the value of changing the status quo and challenging how things are. They may be influenced by both positive and negative role models, affirming the need for parental monitoring of daily activities and contacts. So, the life issues and experiences also influence how the adolescent moves from concrete thinking to formal operations. This includes being able to think logically through situations and become less self-centered. By late adolescence, there are more thoughts on issues that affect the world, the situation of others, and the future as an adult. Healthy cognitive development may occur with positive reinforcement and targeted strategies by caregivers and healthcare providers. Adolescents should be included in discussions about various issues, topics, and events affecting the world. Caregivers should be encouraged to allow the adolescent to share their thoughts and opinions as well as participate in goal setting with the adolescent. Adolescents need to make decisions and have space to self-evaluate good and bad decisions without harsh punishment. So, the psychosocial development. Adolescent experience rapid physical changes which may lead to more self-awareness and self-judgment of external characteristics. In contrast, it may engender uncomfortable thoughts of self-criticism and comparing personal status with the others. During the period of rapid growth, adolescents assume that everyone is looking at them and internally wonder if they are normal. One of the main goals of an adolescent 12-child examination is assurance that the adolescence is normal. It is imperative to include that growth occurs in a sequence. However, the timing is very individualized. The major tasks related to psychosocial development during this period are attainment of independence, body image awareness and acceptance, the ability to build healthy peer relationships, and identity development. So Freud characterizes the adolescent period as the genital stage. This stage lasts throughout adulthood. During the genital stage, adolescents begin to venture into romantic relationships. Adolescents begin to explore sexual interest. The overall goal is to learn how to balance the various areas of life that affect the relationships. Adolescents progress through the fifth and sixth stages of psychosocial development according to Erickson's stages of development. So we have identity versus role confusion for 12 to 18 years old, and intimacy versus isolation for 18 to 40 years old. During the fifth stage, adolescents are attempting to identify their own personal values, morals, and goals. The main objective is to answer the question, who am I? The adolescent begins to develop a sense of self. So for early adolescents, they are the people are persons who are age 11 to 14 years old. So the first stage of puberty begins in early adolescence with a period of rapid physical changes. The changes often cause increased anxiety related to what is normal. At this age, the adolescent has concrete thinking, which means they think more in terms of black and white. Say, for instance, what is right or wrong. So for middle adolescents, they are those persons who are 15 to 17 years of age. Physical growth is usually complete by middle adolescence, but the brain continues to grow and develop. During middle adolescence, boys are generally better at physical activities than the girls. This is a period when adolescents establish their own personal identity and seek autonomy. For late adolescents, they are the ones who are 18 to 21 years of age. Late adolescence is a period known for frequent life changes that involve home, school, work, and personal identity. At this point, males and females are gaining a sense of self and acceptance of their physical appearance. Males may continue to develop physical until the age of 21. So there are some adolescent developmental red flags that parents need to address. So for early adolescents or for those persons who are age 11 to 14 years old, there is a developmental red flags in their physical appearance if the puberty beginning in females before age 8 and in males before age of 9. Delayed puberty, so for boy 14 years or older or girls 13 years or older with no signs of puberty. So they have delayed or decreased rate of growth, sudden weight loss or gain, accelerated growth or tall for family. In terms of cognitive development, so there is a developmental red flags for age 11 to 14 if they experience abnormal headaches, failing classes, problem paying attention in the class. So for middle adolescents or those persons who are 15 to 17 years old, there is a developmental red flags if there is a developmental red flags in their physical appearance if girls who have not progressed with menarche within 5 years of breast buds, and then males who are not at Tanner 5 within 4.5 years of start of puberty. Then they have sudden weight loss or gain, delayed or decreased rate of growth, and report of unsafe sex. Then in their cognitive development, there is a red flag if they experience abnormal headaches, failing classes, problems paying attention in the class. Then in the late adolescence, for 18 to 21 years old, so there is a developmental red flags if they experience delayed or decreased rate of growth in their physical appearance. Then there is a sudden weight loss or gain and the report of unsafe sex. And then for the cognitive development, there is a developmental red flags if they experience abnormal headaches, unable or unwilling to plan for their future, and problems paying attention in the class. So those are some of the developmental red flags that parents of adolescents address need to be addressed. And that's all for my report about developmental milestones of an adolescent. So thank you for listening.
My respect to our professor, Ma'am Nerissa M. Beatriz, to my virtual classmate and groupmate, good morning. My topic is the continuation of Chapter 12, Growth and Development During Adolescents. Moral development. Adolescents are better able to understand that there may not be a definite answer to every question. As they develop, adolescents are increasingly able to understand why some people make one choice, while another group of people makes a different choice. Adolescents have a greater appreciation for logical thinking and value conversation around various topics with the adults they trust. Adolescents can better understand rules once those rules are explained and they are allowed to ask questions. Sleep or rest. The National Sleep Foundation (NSF) recommends that an adolescent get at least 8 to 10 hours of sleep per night. NSF 2020. Adolescents are known to skip sleeping to attend social activities, school sports, social media participation, and video game playing. Physiological changes during the adolescence stage, including further brain development, require that the adolescents get sufficient sleep. According to NSF National Sleep Foundation, they recommend that an adolescent get at least 8 to 10 hours of sleep per night. But nowadays, we all know that some of the adolescents they sleep late because of playing video games. Sometimes they sleep very late. Bedtime routines can involve reading a book, taking a bath or shower, listening to calm music, or journaling. Poor sleep hygiene not only results in a tired adolescence, but also can affect brain development. Screen time can also affect the sleep patterns of teenagers. It will cause to insomnia and even symptoms of depression in the adolescent population. The lack of sufficient amount of sleep can contribute to illness, acne, short temper, aggressive behavior, and a limitation in the ability to concentrate and solve problems. Sleep hygiene is essential for the adolescent population. This includes going to sleep and waking up at the same time every day, keeping a relaxing bedtime routine each night, and avoiding any screen within 1 hour of bedtime. In fact, it is best to encourage parents to provide technology-free bedroom for their child, with no electronics of any allowed in the room at night. According to Guhel and Han of 2018, adolescents with shortened sleep duration are at risk for lower insulin sensitivity, hyperglycemia, poor diet, and obesity. When adolescents are sleeping for a shorter amount of time, they spend less time in rapid eye movement sleep, which is also linked to increased weight gain. Part of the hormonal link to sleep involves leptin and ghrelin. In patients with shorter sleep duration, ghrelin levels are increased and leptin levels decrease, which causes an increase in hunger. It is important that the adolescent have sufficient sleep to avoid sickness, because if the adolescent have a shorter sleep, the part of the hormonal link will affect, especially the leptin and ghrelin levels, then it will cause hunger. Nutrition. During adolescence, the body demands more energy and protein, 2,200 to 3,000 calories per day, due to rapid growth and development. On average, boys require 2,800 calories per day, while girls require 2,200 calories per day. Adolescents who participated in sports will need more calories per day due to increased energy levels. Healthy eating is essential to growth and development of the adolescents population. It also prevents several health conditions. Adolescents should use a healthy eating that includes a variety of fruits, vegetables, whole grains, fats-free or low-fat dairy products, protein foods, and oil. Adolescents need to eat breakfast each morning. This can improve cognitive function, including memory, and reduce absenteeism. Eating a healthy breakfast is also positively associated with improved mood. Adequate hydration is important as well, as it is also associated with improved cognitive function. According to Lassie et al. 2017, micronutrient supplementation, especially with iron, can decrease the prevalence of anemia in the adolescents population. Adolescents should also limit calories from solid fats as well as added sugars. They should also reduce their sodium intake. This leads to increased weight gain and obesity. When calorie intake decreases to become less than the basal metabolic rate, then this can cause issues as well. The energy cost of growth and activity energy expenditure are affected, causing decreased growth rate, daily in puberty, amenorrhea, and issues with bone mass. Another important aspect of nutrition to consider is metabolism. The component of metabolism are energy cost of growth, basal metabolic rate, and activity energy expenditure. Issue arise when the caloric intake of adolescent is greater than energy cost of growth and activity energy expenditure. Let's proceed. Common development issue. Number one, risk-taking behaviors. As adolescents begin to self-identity and create a life outside of their family unit, they begin to participate in more risky behavior. Adolescents are known to experiment by testing limits and breaking parental and societal rules. Independence display by the adolescent is a natural occurrence and a positive growth factor but requires self-management. Parents begin to feel conflicted about when to intervene and how to address their cautions and concerns with the adolescents. The healthcare provider becomes a parental and adolescent resource. Number two, tobacco use. The use of tobacco typically starts during adolescence. There has been an increased usage of tobacco products with the emergence of vaping and e-cigarettes. Current data indicates that 67% of adolescents in high school and 49% of adolescents in middle school have used flavored tobacco within the past 30 days. Cigarette smoking during adolescence causes significant health problems among young people, including an increase in the number of severity and respiratory illnesses, decreased physical fitness, and potential effects on lung growth and function. Number three, alcohol use. Alcohol is the most widely used substance among adolescents and is nationwide concern. According to the CDC 2020, alcohol is the drug used and abused most often by adolescents. In 2019 survey, 8% of 8th grades reported drinking within the past 30 days, with the percentage increasing to 29% in the 12th grades. Johnston et al. Drinking adolescents can be harmful to young people's physical development. particularly brain development. Adolescence is a critical period in a young person's development towards adulthood. What they learn during teenage years and how they learn it can set the young person's path for later life. Alcohol consumption during this time can bring about learning difficulties, memory problems, and other problems later in life. Number 4, opioid and illicit substance use. While adolescent alcohol use is significant concern, adolescents are also involved in the use of opioids and illicit substances. The adolescent brain is maturing and is particularly vulnerable to substance use, placing the adolescents at increased risk for substance misuse and addiction. Inman et al. 2020. Number 5, acne. Several hormone changes occur during the adolescent period for male and females. The body grows rapidly and produces hormonal stimulation that prompts the sebaceous glands to produce more sebum. The extra sebum creates an overproduction of dead cell, which leads to acne on the face, neck, chest, and upper back. Acne is an issue that affects the majority of adolescents. It is not a serious health issue. However, severe cases can cause significant scarring and have a negative effect on self-esteem. Adolescents and young adults between age 12 and 24 tend to be the most affected group. It usually begins during the start of puberty, affecting girls earlier than boys. What causes acne? Acne is inflammation of one's skin pores, which consist of the hair follicle and sebaceous glands that are most commonly located on the face, back, and chest. What usually causes this inflammation is related to abnormal skin process including increased oil production in sebaceous glands, change in hormone levels, and overgrowth of bacteria. Next common developmental issue is dating and sexuality. During middle adolescence, adolescents begin to become intrigued with dating. However, it is common for some adolescents not to date until late adolescence. Adolescents begin to identify with their sexual identities, which allows for the formation of adult relationships. The word dating is not used as often as it was in the past. The new terminology is now going out with someone possibly romantically involved or hanging out typically with friends. Next common developmental issue is health issues related to sexuality. Selected health issues related to sexuality include pregnancy and contraception and sexually transmitted infectious or STI and human immunodeficiency virus. Conversation about sexuality may be difficult for some providers and for adolescents, but the provider must always place the adolescent's safety first. Discuss with the adolescents that the consent is always required for any type of sexual activity. The following are selected healthcare providers' principle of care for the preceding health issues related to sexuality. This is the principle of care for the preceding health issues related to sexuality. Number 1, sex education. Number 2, confidentiality. Number 3, emotional support. Number 4, normalization. Number 5, respect the patient preferences. Number 6, direct questionings. Conversation on sexual behavior are often avoided by healthcare providers but are imperative to providing holistic care to the adolescent. Asking specific questions will help improve patient participation in the discussion. Another common developmental issue is suicide prevention. Suicide prevention is a topic that is essential to address at every adolescent visit, whether for a well child check or a sick visit. The first aspect to assess is the availability of firearms in the household. It is important to ensure that if there are firearms in the home, they are unloaded and in a locked safe that is inaccessible to children. Access to firearms increases the risk of suicides and accidental deaths associated with firearms. Healthcare provides and primary care should refer patients with mental health issues to specialists who can provide pharmacological treatment. The treatment for these conditions can also decrease the risk of suicide. Adolescents with depression may have increased suicide ideations when taking antidepressants, but the risk of suicide attempts due to having untreated depression is higher. Thus, pharmacological treatment is recommended. Adding cognitive behavior therapy can decrease this side effect. Another common developmental issue is social media issue. Social media use in the adolescent population continues to be an area of concern among healthcare providers. However, adolescents use social media as a way to increase their social connections and learn technical skills. Adolescents have also reported that social media is used to strengthen peer relationships, allow them to support others their age on specific issues, and provides them with a different viewpoint on various social issues. While media use is an integral part of the daily life of adolescents, there are a number of risks associated with social media. Use specifically negative effects on mental health, cyberbullying, texting, sexting, dangers of sexual solicitation, and exposure to problematic and illegal content and privacy violation. The risks that teens face online are similar to those faced offline. However, the risk profile for the use of various types of social media depends on the type of risk, a teen use of media, and the psychological makeup of the teen using them. It is important to note that teens most at risk often engage in risky behavior offline and also have difficulties in other parts of their lives. That would be all my report. Thank you, Ma'am Neri and classmate. Good day.